Hello! So we're here again with Christina, who is 30 weeks pregnant. And there was just some things, we've just been having a discussion actually about when you're pregnant, some of the things that really and truly from a movement perspective, you want to stop pretty quickly. So first thing is coming down onto the floor is an interesting one. So the better way to come down is, if you have blood pressure issues, you want to be very careful dropping your head. So you can slide your hands down your legs. If you have issues, keep your chin up. And then you'd get down however you needed to. Because the bump is in the way, you might need to take your legs wider. And then you come onto hands and knees first. Yeah. And then what she's actually going to do is thread her arm under to then be able to roll onto her side and then onto the back. If I say the other way, often because a lot of us just go, yeah, get down. Not so good. To come off the floor, let's roll to the camera again. Hand goes there. And she's just going to push herself up. Now, why would we do this? Great question. Could you have a seat? Have your feet that way? Yeah. Because when whatever stage of pregnancy you are, and this also applies for postnatal, you might have heard of something called rectus diastasis, or diastasis rectus, sometimes people say it the other way. What it is when the abdominals are two strips, and of course with this, those get stretched and they get looser, they get thinner in the middle. So if, when she lifts both her legs up and her head, if you can see on the camera, we'll try to zoom in later, you get this kind of popping up. We spoke about it in the other video, this rugby ball. Come on down. That means that the abdominal wall is actually pushing a little bit through. It's not a good sign. You don't want it. Whether you're pregnant or not, it's not a good thing to see. So if you sit up, push with your hands to come up or roll to the side. The problem is when she's sitting, have a seat and face that way. Yep. If we did what we do in normal classes and she rolled down, the abdominal muscles that are being stretched, they can't work as much, and the dome, boom. One, is hard to control. Two, your lower back doesn't want to move, and you get this doming look, which is just, it's not strong and secure in your body. So to come up, you wouldn't come up, like coming out of bed, you wouldn't just go, Pia. I'm assuming you don't do that. No.
Not anymore.
You can't. This sort of stops you. So the way to do it, bend the knees, bump, bump, roll either side, get into the practice of doing both. Obviously, you can't lie on your belly, and ta-da, you're up. You stay on your hands and knees. Now, there is some work you can still do for your core, but just no sit-ups anymore, because we want the belly to be able to stretch. So come on your hands and knees. So you can do, and you need someone to really be watching just a little bit for you. You set yourself up beautifully here, especially if you've been exercising before the birth. You float the knees up on an exhale, which is really strong work. And then you bring them down and you go, oh, it's a lot of work. Exhale, lift, and down. What we're looking for is, again, that dome can happen here, and it's often easier because of gravity. So when she comes up, if I was just training her, I would be looking like this. And if her belly was doming, it's not a move that I would want her to do anymore. So if you're doing these things for yourself, ask someone to look at your stomach. We can also add opposite arm and leg lift, which is a little bit kinder than the last move. Exactly. Checking that this is quite cool because you can hug your baby. So if you think of squeezing your baby when you lift, that can help connect the abdominals. You're nice and stable there. And keep changing, one more in each way. So this is a super good one because you've got relaxin in your body right now. All your ligaments get super loosey. They need to so you can give birth, which also means that around here, your sacrum area can get super blah. As I say, it needs to. So if you stay there on your hands, or are you more comfortable on your elbows?
I'm good here.
If you're getting carpal tunnel, drop onto your forearms or rest on a box or a chair. Take one leg only behind you. So the other thing you can do is tap the foot down and then lift it back up. So you work the butt muscles here, as long as you want to be on your hands. Otherwise, you'd be lying on your side. Same thing, we need to go is that bump staying up and in, and the baby is having a beautiful hug? And if so, you can strengthen those muscles around your butt. Not worrying how big a range you go, because too much right now, especially at 30 weeks, cannot feel good. Do you start to feel your pubic symphysis or not? No. Sometimes you start to feel that it's separating, because it will start to, so your pelvis can stretch to give birth. And if you start to feel that, then you want to minimize your moves. And again, keep your glutes beautifully strong. This is looking good. A lovely position. Cool. And you feel, and one side might be easier than the other. Keep them both super strong. Last one. You can do more, obviously, than we're showing you here. And then to stand up, walk your hands in towards your knees. Bring yourself up, high knees. I would take one leg forward. She's going to push down on this foot to then bring herself up. Can you come back down? This is my thing for everybody, whatever age. No hands to come up, so that butt muscle needs to work. Change your leg over. Let's just do one the other way. Again, if the step feels not good, back off, don't do it. Push down to lift up. And it's a beautiful way. If you've seen our other video, come back down again. The lift here is a great way to connect your butt into your pelvic floor with your breath to whoosh, stand you up. How's that one feel? Good. So you can still keep strong, you can lift weights, just no sit-ups, no rounding of the body, because as I say, we want these muscles here. Your six-pack needs to be gone, because look how stretched it is. They need to let go, otherwise the separation is more likely to happen, because your core is too tight. It goes, I don't want to stretch. Doing. It has to. Anything you'd like to add from Christina's been doing a lot of prenatal exercises throughout her pregnancy, which is why she's doing so amazingly well. Anything you would add from those?
The only thing is I would watch out for the doming when getting out of bed or when getting up from the sofa. That's when I noticed the most. I had the hardest time bending forward.
It must feel so weird. I've never had kids, so I'm like, what does that feel like? But beautiful. Take care of yourselves. Obviously, be in touch with us. Hopefully that's helped you just with a few things to look out for. And good luck with your pregnancies and your baby. Thank you, and thank you.